Hello, I'm Fran Spreer-Albert, and I'm the COO and CFO at Albany Med. Today's video update is going to focus all on the Workday project. In a little over a week, we will go live on Phase 2 of our Workday project. What is Phase 2? Phase 2 is financial reporting and supply chain. And where will that happen? That will happen at Albany Medical Center, at Columbia Memorial, at Glens Falls, and at Saratoga Hospital. This is an extremely important moment in our journey as coming together as a system. Who we have here today with us are two of the people doing a lot of this very hard and very important work for the system. Michelle Cakley-Skimersky, who is our Vice President for Finance and in charge of things such as financial reporting, grant reporting, and payroll, to name a few. And Flavius Toder, who is our Vice President for Supply Chain for the system. And what is included in supply chain is contracting, purchasing, receiving and distribution, and of course accounts payable. So without further ado, I would like to turn the floor over to those two folks who are working so hard to bring this world-class product to all of you. Thank you.
Good afternoon, everyone. I'm Flavius Toder, Vice President of Supply Chain for the Albany Med System. And
I am Michelle Cakley-Skimersky, Vice President for Finance.
So Michelle, we are a few days before the big bang with Workday. So we want to let everybody know what's coming, and we'll start with what's changing first in finance and supply chain.
The biggest change you'll see in finance is that we'll have new cost centers and new accounts. A couple of years ago, when we decided to go with a new ERP system, we did set some guidelines, and the biggest guideline we had was to try to get very clear and consistent reporting across all the campuses. In order to do that, we actually broke down everybody's cost centers and revamped them and rebuilt them. Therefore, now each campus will have the same numbers for the departments that we're looking at. This will hopefully ease very clear reporting and actually ease in terms of trying to requisition.
And for us in supply chain, the biggest change will be the electronic requisitioning and electronic approval. Here at Albany Med, we already do that with Lawson, but the affiliates mostly do paper or phones or emails. So that will be probably the biggest learning curve for everybody. Expense reimbursement is another area that we are going electronic completely. So there's not going to be any more paper shuffle around. Everything is going to be done through the system. We'll have one system item catalog for all the products, and also a master supply vendor supply list that everybody is going to be using in the same time, so it's not going to be separate at each facility. And we'll also centralize purchasing and accounts payable. So those will become one department for the entire system that will be under my department. One big change also will be the mobile application, where we will have, our smartphones could be loaded with these applications where we can do certain tasks in Workday. So that is definitely a path forward, because right now we don't have anything like that. Everything needs to be done either in the laptop or on desktop.
Yeah, it makes it so convenient to just go on your phone and approve something when you're not at your desk or even around.
How about reporting? That's new for both of us.
That is. So each of the campuses currently have their own reporting mechanism. They report both on a different system, and they also report differently in terms of the delivery method. Going forward, everything will now be reported through Workday, and it will be available to the end user. So again, really stressing consistency and transparency of reporting among all the campuses.
One feature that I like about reporting is the ease of exporting in Excel and being able to manipulate the data, something that today is not possible with the reports that we have, from the legacy systems. Yep. We'll also work on standardized policies for the system. One policy is the reimbursement policy that has been approved and will be starting July 1st. A few policies in your area, I assume, will be as well.
Ours are more behind the scenes, but one of the biggest items that we saw was inconsistency in terms of what we determined to be capital and not. Very small, minor differences. One campus may use a threshold of 2,000, one may use 3,000. We came together, we decided on one basis, so now everybody will have the same definition of what capital is, and we'll also be using the same definition in terms of how many years we depreciate it for. So big changes there internally for our finance folks.
Perfect. There's going to be a lot of data to look at. I know that Workday has a lot of flexibility how we pull the reports and the information. So to accomplish all this, we need to do a lot of training. So that's what we are doing this week, next week, and actually we started at the beginning of the month with some of folks, in the mid of May. Requisition and training is being done till day, is available in HealthStream. Everybody should be taking that training and make sure that you pass the test at the end. You have to have that test pass in order to be able to do requisitioning. Make sure that your manager gets the approval training done, because the requisition will not go through without an approval. And all that will be electronic, like I mentioned. Expenses for reimbursements are also electronic, as I mentioned, and the training is available. Is a self-enrollment for the most part, so make sure that you search HealthStream, correct,
Yes.
to find the course in there. There are available open practice sessions at each location. Change management has been working on that, and we have staff, helping in those sessions anybody that comes to practice. If you need to find more information about training, go to the Care One ERP page. You'll find the schedules in there, and you'll find tip sheets. We'll also load something on the supply chain website, with the same information, so you have two places to go to in case you don't remember where the Care One ERP is.
I think that's an important aspect to point out, Flavius, is we did different techniques to try to train. So there's video, there's sessions that you can go to, and there's tip sheets. So there's different mechanisms that people can utilize to learn the system. Key, though, is requisition and making sure that you take the test for that and you passed it. Otherwise, you will not be permitted to put in a requisition.
Right. And one thing, to mention for finance, it's a reporting training is going to be done.
Correct.
In July.
Because of the timing of when we went live, we held off on report training until mid-July. The transactions will start July 1st, as Fran mentioned earlier, so we will not have raw transactions in the system for anybody to do reporting on until after that date. So we did hold off until July in order to get that training available and have data available to look at. So you will see training in July for your reports, with the expectation that the July month end, which will be sent out or finished in mid-August, will then be out of Workday and consistent across all campuses.
Great. So to make all this happen, we have a transition period that it starts this week, and there are going to be some blackout dates in this week and next week, before we go live. One important one for requisitioners is placing requisitions. The last day to be done is going to be tomorrow at the end of the day. So in all legacy systems, that's the day, to place all your requisitions. Next week, you will not be able to place any of them, unless you have par replenishments, and that is going to be handled by supply chain staff. Command center, we are discussing right now, how we are going to run it. More information is going to be available through the messenger, I believe, in other emails. We will have staff, on site at the 1275, where the command center is going to be located, to answer phones, and we will have at night, somebody to be contacted in case people have questions, trying to do certain tasks. Also, we have super users being trained. So the super users will be located at each location, and they will help users, to get up and running, if they have questions about how to access, the system, how to place a requisition, how to fill out, certain fields, and so on. So that list will be available as well, for everybody to access it.
Yes, so if somebody has questions when we go live, they do have two mechanisms: call command center and get some information there, or seek out the super user that might be available to them to help them with those questions. So hopefully we're getting enough methods out there that everybody has an opportunity to get their questions answered.
Yeah, and the tip sheets will be helpful because they have screenshots, and they have step-by-step, how to do it, so please, go to your super user or the tip sheets, before you pick up the phone to call, because we expect quite a few phone calls once we go live with the command center.
And just a note that you all will receive, if you're cost center managers, a mapping of the legacy cost centers to the new Workday cost centers during next week, right before we go live. And there will also be a mapping for accounts, which are expense accounts, to what we call spend categories, and revenue accounts to revenue categories next week as well. So go through and make sure you see them. And if you're a requisitioner but you do not get those from your person that's your cost center manager, please reach out. You will absolutely need them in order to process any requisition in the system.
And as we go live, it will be easier to identify the locations and the cost centers because we will have a 3-digit numbering assigned to each company. So for example, Albany Med is going to be 150, the corporate is going to be 100, Saratoga is going to be 250, and so on. So it will be easier to identify which company we are working with or transact with, based on those 3 digits.
And most people will like the spend categories because they are now alpha. So you look for office supplies. You don't have to look for a number of 63 da 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 da.
Yeah.
So it's easier for most of the end users to have those.
Yeah, search capability is definitely it's very flexible. So I think that's what we have in a few minutes. We expect that we will get phone calls, emails. We are here to help. Our teams are ready as well. And I think good luck for all of us. Once we go live. Luckily, it's on a Saturday, so it's going to be a slower day.
And I think we want to thank our teams. We have some
Absolutely.
amazing people underneath us that have really done such a massive amount of work to get this to where we are. So each of our own departments, as well as the other campuses, in the case that the controllers have been amazing on collaborating with us for each of the other campuses. So I don't think we could be where we are without them. So
Yeah.
thank you all.
And of course, Fran support
And
as
Fran,
well.
yes.
Well, thank you, everyone.
Thank you.
Thank you so much, Michelle and Flavius, for an outstanding presentation. I'm just going to bring forth a few of the key points that each of them made. Again, live date for Workday across the system is July 1. It impacts financial reporting and it impacts supply chain. What are a few of the biggest changes? All of the cost centers have been relabeled, renamed. There will be a site as part of training, but as well as on the Care One intranet site that shows the mapping of those new cost centers. In supply chain, everything is now electronic. No more manual recs. So whether you're ordering goods, services, or submitting for personal reimbursement for travel or other expenses, it will all be done electronically. What is so important over the next week is training, and more training. So you will see in HealthStream, there's training for all of you to take with respect to how that electronic requisitioning will work. You will also see that there's practice sessions being held across all of the campuses to allow you some more hands-on approach and interaction with our super user group. And throughout the entire Go Live process, there will be a command center which you can call in order to get help if you are struggling post Go Live with any of these processes. But want to again congratulate the entire system for this project. As we said earlier, this is a major, significant step in becoming a system, all moving on to a singular platform. Lastly, and most importantly, I want to thank all of the professionals across our entire system who have worked so hard to bring this vision, to bring this project to life. Thank you, thank you, thank you. And on behalf of Dr. McKenna, I want to say take care of you, take care of each other. Bye-bye.